Good evening, everybody. The time is 6 o'clock. I am speaking to you from London, but we're also talking to you today on this very important edition of the Diabetes Chai Chat from Leicester, our centre. We've had over 170 separate editions of Chai Chat, but this is a first for us. This is the first that's going out live on our YouTube channel, the Silver Star Diabetes YouTube channel, so that everybody all over the world can actually watch this particular edition and all editions that are to come. In the past, of course, the only people who are allowed to be on are the people who we send a Zoom link to, but this is now much wider, so we're going to be joined by many other people on this particular event. I hope everyone has their chai with them, and we will have, no doubt, a lot of chat as we go along. Our guest speaker today on our first YouTube live channel broadcast is our dear friend and supporter and colleague since the very start of Chai Chat, Hina Trivedi. So even though she's shiny new for the channel, she's been with us for many, many years. She is a senior GP running probably one of the best GP practices that we have in the whole of Leicestershire. She qualified in the United Kingdom. She then went to the United States, and for 14 years she practiced in America and was an assistant professor at one of the universities there. She has a master's from the University of Leicester, and I'm delighted to say she is our specialist in diabetes for the whole of Leicestershire. So we're going to have a general chat about current developments. I have my questions ready, and then we will go around the country to see if anyone else has also got questions. So can I give you a warm welcome, Hina Trivedi, to our first ever Chai Chat on our YouTube channel.
Thank you very much, the Right Honourable Keith Vaz. It's been a pleasure to have been with you since inception.
You just have to put the ID.
Oh, carry on. He's just talking.
Hi, sorry, I'm so sorry about that. So yeah. It's absolutely a privilege and a pleasure to be with you. I think what you're doing is tremendous. You've started this forum. We've been going at it for so many years, even through COVID, and you have educated, you have empowered and engaged so many people on the topic of diabetes. And actually, when we look at all the evidence and we look at all the studies that have done as to why is it that we don't treat diabetes as well, it is that only, that we don't educate our patients, we don't engage them, and we don't empower them. So this is fantastic. So today, what I thought would be the most appropriate thing is actually to speak about an overview of diabetes, about what are all the things that everyone with diabetes should actually think about and care about. So we looked at the 15 essential care processes that actually should happen and that all of our viewers and all of our listeners should actually understand. So if we could have the next slide, please. So we've divided the 15 processes into 5 different slides, and we're going to talk about them in groups of 3, sorry. So the first thing that everyone should actually really, really be interested in is what their diabetes control is like. And that is measured by lots of ways. We have continuous glucose monitoring now with various machines like Libre, Freestyle Libre and Dexcom, but really the gold standard is our blood test, which measures our hemoglobin A1C. And this is a topic very close to my heart, because when I did my master's, this is what I looked at. If somebody knows their own hemoglobin A1C, does that mean that it's better controlled? It's an intuitively yes question, but we didn't actually have evidence. We looked at diabetics across 7 different countries, across the whole of Europe, and looked and studied them. And we asked people whether they knew what their result was. And actually, when we did our statistical analysis, we found what we thought would be right is that if you understand your diabetes and you know your hemoglobin A1C level, your diabetes is likely to be better controlled, diagnosed, and so on. We like to have tight targets for younger people who are newly diagnosed, and you should be aiming for a hemoglobin A1C of 6.5 to 7. But as you get older, we relax those targets, because the last thing we want is anyone to have a tight target, low blood sugar, fall over, hurt themselves, and so on. So discuss that target with your doctor and make sure you know what that target is. Secondly, and very importantly, know your blood pressure. Again, lots of studies have been done in the world for this too, that if you know your blood pressure, does that mean that you have better control? And in America, they did those studies. And of course, if you know your own blood pressure, you do have better control. Now with COVID, we had this big fright of getting infections, and I made sure that we encouraged everyone to get your own blood pressure machine at home, because then only you can check your blood pressure and you can see if it is in control or not. So I would advise all of you to buy a blood pressure machine. They cost about £20. Keep it at home. Check your blood pressure once a day at the same time when you're relaxed, after you've had a cup of tea, whenever, but at the same time every day, and check it and keep a tally of what your blood pressure is. So depending on whether you have underlying kidney disease, heart disease, and so on, you want to aim for a blood pressure of 130 to 140 as the top number, which is the systolic, and a number of between 80 to 90, the bottom number, the diastolic. So there are two numbers that you need to think about with the blood pressure, the top and the bottom number, and aim for something between 130 to 140, 80 to 90. So that's blood tests and blood pressure. And then the third thing to think about is your cholesterol and your triglycerides. Now, we're at a very exciting time now, not only in diabetes, where we've got lots of new diabetes medications, but even for cholesterol, we've got fantastic new medications now. We've got injectable therapies that you take every 6 months and so on. And all your GPs should start talking to you about these medications. Most people are on statins, and statins are the mainstay of treatment for a high cholesterol. Now, most people think that their cholesterol may be normal, but the most important thing to actually understand is that cholesterol is just one of the risk factors for heart disease. Blood pressure, diabetes, cholesterol, smoking, all these are risk factors, and now kidney disease also. So if you have multiple risk factors, and age is a risk factor that we can't control, we can't stop getting older. And as we get older, we have a higher risk of heart disease. So all of these risk factors are put into a table. We figure out our risk, and then we decide whether you should be on a cholesterol tablet or not. Most people need a cholesterol tablet. It's important that you have your cholesterol and triglycerides and your risk assessed at least once a year. And I would encourage all of you to be on a statin and other medications as per your doctor. Other medications could include ezetimibe, bempedoic acid, new medications called inclisiran, and then there are new PCSK9 inhibitors, which are actually usually only used in the hospital. So those three things make up the three treatment targets: hemoglobin A1C, your diabetes control, your blood pressure, and your cholesterol. Very important. If you don't remember anything else, remember those three things that we need to get to target. Great. Next slide, please. Now, why do we treat diabetes? Why do we treat our blood pressure at a certain target and cholesterol? We talked about heart disease and stroke. Those are macrovascular complications. So the whole point of treating diabetes and all these other things is to reduce your risk of having a heart attack and stroke. But in addition to those macrovascular complications, we know that patients actually suffer from microvascular complications. So that's problems with your eyes, problems with your feet, and problems with your kidneys. And so all those three things are measured very regularly, at least once a year in the surgery by your doctor. It's important that you go and get your retinal screening done. In England, we are very, very lucky that we have this huge retinal screening program that is free. And so you'll be invited to get your eyes checked. Please go and get them checked. And then remember to check your feet every day. It's important that when you wash your feet, you dry them, make sure there's no infection in between your toes, make sure that your feet haven't been injured, because sometimes when we get nerve damage, we might hurt our feet and not realize that they're injured. So it's important that you check your feet every day, and then of course go to your nurse or your diabetes specialist and get your feet checked at least once a year. And then thirdly, your kidneys. We now know that kidney disease has become a risk factor, an independent risk factor of heart disease and stroke. And so it's important that you get your kidney checked at least once or twice a year. That's through a blood test. And also take your urine in. We'll be checking it for protein. And if it does have protein in, we will be starting you on medications that reduce your risk of progressing kidney disease. So these are the microvascular complications, your eyes, your feet, and your kidneys. And remember, diabetes is the most common cause of secondary blindness. It's the most common cause for people progressing to kidney failure. So really, we need to protect your kidneys, protect your eyes, and protect your feet. Okay, next slide. The other things that we need to talk about are food and diet. It's important that you discuss that with your healthcare professional. I wish we had enough dietitians for all of you to speak to a dietitian, but if not, at least please speak to your healthcare professional. So ensure that you eat healthily, 5 a day, that we all know that. Make sure that your plate is full of proteins and you get your vegetables and fruits, follow the colors of the rainbow, and ensure that you have a nice, healthy diet. And then emotional and psychological help. It's essential and absolutely crucially important that you look after your mental health. Just 2 days ago, I was actually talking to some diabetes specialists, and I said, if we don't tackle the mental health aspect of people, we won't actually treat their diabetes. I know that when my patients are troubled by stress, they don't take their medication and they don't look after themselves. So please go and speak to your doctor, get some help. We've got counseling, we've got talking therapies, we've got cognitive behavioral therapy, we've got medications, we've got lots of things. Don't sit and suffer in silence at home. Please get some help. And then thirdly, we do have group education. So when you're brand new diagnosed, we should be referring you to group education, and ask your surgery. You may have group education available. And this would be something that would be really useful to all of you. Because remember, you're not alone. The same question that you think is silly and you don't want to ask might have been in somebody else's mind. And so this is something important. Okay, next slide. These three things are a little bit little bit out of our control, but things that should be done. So it's important that when you see a diabetes professional, well, first of all, you have access to a diabetes professional, whether it be a DSN, a diabetic specialist nurse, an HCA, or even just your doctor or a specialist at the hospital. So it's important that you have access to a diabetes specialist to discuss your problems. Secondly, remember every year to get your flu vaccine and your COVID vaccine now. In fact, the government has just rolled out that we're going to be giving your COVID vaccine together. There's a big hoo-ha about, unfortunately, that we might be delaying it. We were hoping to start rolling out the flu vaccinations in September, but the Department of Health have now told us that we may have to delay it because we're going to do the COVID and flu vaccinations together. But not just your flu and COVID vaccinations, make sure you get your shingles vaccination. If you're eligible for your pneumonia vaccination, get that done too. So vaccination is a really important thing. And then if you have to go to the hospital, it's essential that you get good care. Now, this is, of course, out of your hand. This is what I was talking about earlier. We want to ensure that if you are admitted to the hospital, you have a good diabetes team that actually looks after you, that understands your medication. And I would urge all of you, take your medications in with you in the hospital, particularly if you're on insulin. Unfortunately, some of our staff may not be local staff. We might be having bank staff. They may not be up to date with policies. And usually we find that our patients know the medications better than anyone. And so you become your local expert. You become your expert in your disease. And that's what this is all about, is empowering you that you know what your blood test results are, you know what your blood pressure is, you know what your medication is. Okay, last slide, please. This is the last slide, but I think it's one of the most important slides. So it's really important for all of you to understand these three things. I'm going to start with the bottom one first. If you're planning to have a baby, then it's very important that you speak to your diabetes professional, because we want you to be very well controlled, because diabetes affects women in pregnancy. There's a big associated maternal mortality. That means that pregnant women who have diabetes, there's an increased risk of death. We don't want that. We don't want risk of complications. And then we don't want the baby to suffer as well. There's lots of complications in children. So it's really important that you get your diabetes well controlled before pregnancy and during pregnancy. And during pregnancy, we'll ask you to stop various medications. We don't want you to take a statin anymore. We wouldn't want you to take a lot of your diabetes medications, and also stop your cholesterol medication. A lot of women have switched over to insulin because we want really good control. So pregnancy. Then the other thing is, and probably one of the most important things together with the 3 treatment targets that we talked about earlier, is please stop smoking. Smoking is totally injurious to health. It's written on every single packet, but really it is. It really is an unnecessary risk. It's a risk that you can actually change, and it's a risk that you can control. So please try and stop smoking. We have lots of smoking cessation help available, and I would like you to speak to your healthcare professional and get that help. And then last but not least, I wanted to speak about sexual dysfunction. So lots of people lose their libido, their desire for sex, sexual intercourse. Sexual intercourse, the actual act of sexual intercourse, is also made more difficult with diabetes. Men may suffer from premature ejaculation. They may suffer from a difficult in erection, a difficult in sustaining erection, a difficult in ejaculation. In the same way, women may not orgasm. Women may not feel that they want to have sexual intercourse. So all these problems can be from diabetes in itself. Please speak to your diabetes professional about this. We do have medications to help you. We have Viagra, we have lots of other medications, we have lots of we have injections, and we have sexual therapy, all of these things available. So it's quite a taboo subject, and often in the Asian community, it's not addressed. So I would turn around and say to you, please, if you have these symptoms, if you have any of these issues, I'd like to speak to your healthcare professional, and I'd like you to address them. So that's a quick whirlwind tour of 15 care essentials that I really think that you should all take care of. And because this is our inaugural YouTube live video, I thought this was a really good idea to summarize what all you should be taking care of and thinking about. And I'm going to open the floor for questions. And I just want to say thank you very much for allowing me to educate you all, to be part of your diabetes journey. And I really wish you all the very best.
Thank you very much, Dr. Hina Trivedi, diabetes specialist from Leicestershire, for your marvelous presentation, putting all 15 in exactly 15 minutes. So that's never happened before. So it's a point, and we're very grateful to you, as always, for all amazing work that you do.